Good afternoon. Today we're going to explain the case with the London Protocol for the investigation and analysis of clinical incidents, which its main purpose is to improve health and safety. It focuses on preventing accidents and medical errors through an analysis of the incidents that occur in the clinical environment. So now we are going to talk about the case.
Now, to put the case into context, a patient with sequelae of a stroke was found presenting moderate to severe left hemiparesis, difficulty with transfers and walking, and severe dysphagia. He was accompanied by a family member and assisted by a nurse who placed a nasogastric tube after leaving the ICU 24 hours ago. Replacing parental feeding, the tube was fixed in the left nostril. Then, when the physiotherapy and speech therapy team arrived, they noticed that the tube was not properly fixed. They informed the shift manager, but treatment began without a timely response, causing the tube to completely come out and nasal bleeding. The adverse event was reported and tube was repositioned to continue with nutritional support.
Analysis. Patient with nasogastric tube for nutritional support is rushed at 13 hours by the physiotherapy service for audiology and students in other perform a treatment. But they notice that the probe is not fixed in the nostril. They stop the passage of food before starting the treatment. They also release that there is displacement of the probe before starting the intervention. Then the student give notice to the head nurse in charge to perform the fixation fixation and thus will prevent the exit of the nasogastric tube. But the professional does not attend the call at the movement, and the therapist begins with the treatment, which causes the total exit of the tube and generates subsequent epistasis. The inconformity is recorded, and the supervisor on the reports the adverse event, as well as the new passage of the tube to generate the nutritional supports. Factors contributing to adverse event. Patient's factors. Be presenting sequelae of a CVD that generate significant motor compromise and severe dysphagia. Complications for feeding through the nasogastric tube are increased. Difficulty in transfer and ambulation activities may generate that the patient does not have the ability to collaborate with the procedure. Procedural factors. The nasogastric tube not being well fixed in the nostril generates displacement of the nasogastric tube during the therapeutic intervention. Before performing the procedure, the head nurse did not check the tube was in proper position and fixation, which is essential to avoid displacement and possible injury to the patient. The absence of a timely response by the shift supervisor to the warning given by the trainee contributes to the factor that appropriate corrective measures were not taken in time. Environmental factors. In the clinical setting, with the presence of multiple professionals, it may have generated distraction and failures to communicate about the status of the probe. Organizational factors. The situation indicates that there are failures in terms of adherence to the protocols established for the insertion and management of nasogastric tubes. Hence, the need to train the personnel involved in these procedures. In conclusion, it is important to rigorously follow protocols and ensure assertive communication among members of the medical team to prevent this complication with vulnerable patients.